And my view is you need to work with yourself because only you can really heal you. You can go to a therapist and they can give you beautiful tools, and so can a coach. There's a lot of tools out there, there's a lot of things out there, but I'm very much of the belief that it should come from the ground and it should be natural. Because at what cost are we using unnatural things? Some people receive visually. They see potentials playing out, or they see the past playing out. Sometimes it's just a feeling. It's just this knowingness, this download of just knowing something and realizing, making a realization. It's been done for thousands of years by shamans, by people in South America and North America, Cherokees, um, Sangomas, and I think that we need to respect it as the medicine that it is, because it's working with you, and you need to be ready. If you're not ready, you're going to fight it. I've seen people fight and then they say it's a bad trip. I don't believe that there's such a thing. There's no such thing. It takes you where you need to go. When you don't set intention and you just take it, then yeah, it's just Alice in Wonderland, and just have fun and see some colors and, you know, have some cool conversations. When you work with it quite deeply is when you set the intentions, and that makes all the difference. And then in 2016, there was a gold standard study, which they took cancer patients with life-threatening diagnosis, and the results show that more than 80% of them had significant reduction in anxiety and depression.
Here find teachings to enter God's kingdom. Natural ways, that is what we uncover, to live life aligned, sister and brother. So today we're joined by Ofri Kandor. She's a life coach. She's done a psychology degree. And today we're going to talk about plant medicines and how those can help your psychology and well-being. So Ofri, welcome to the show.
Thank you for having me.
So Ofri, I'm very curious to understand how you got into um, helping yourself and fixing your psychology, because that seems to be a journey that really helped you to get to where you are right now.
Yes. So I think, wow, I think I've studied a lot of different things from, education, psychology, coaching. I also studied acting, was my original degree, and which taught me a lot about the human motivation and psyche and subtext. And yeah, I think my journey with psychology, I was always interested in it. Human behavior always interested me and fascinated me. Why people think the way they think, why we think differently, why we react differently, what is a reaction, all those types of things. I ask a lot of questions, and I've always just found it very interesting. And I've always found that people get drawn to me for help, for advice, where things are going on in their lives as well. And that I'd have that natural affinity to want to help. But we can't help others until we've helped ourselves. So I believe that that's something that's ongoing. It's not like, okay, I'm fixed now, I'm healed, that's it, now I can help everybody else. But I do think there's a level of healing that needs to happen, and self work and self development that needs to happen. And that is something that I've always been interested in. And that's why I kept studying. Um, I was in a difficult relationship. One of my relationships was quite toxic, even I would say psychologically abusive. And he refused to go for therapy. And he said, well, you're not happy, so you go for therapy. So I did. And it was through that that I realized what I was actually in, and that it wasn't healthy. And although therapy helped me a lot and helped me to come actually out of it and realize that I shouldn't be in this, it's not healthy for either of us. Um, I felt like there was still some stuff that it didn't quite help enough. It helped a lot, don't get me wrong. Therapy definitely has its place. But I feel that talk therapy can only help you so much. I feel that you need to also include the physical body, which Bessel van der Kolk often speaks about. He wrote the book, The Body Keeps the Score. He's a psychiatrist. And we store trauma and we store things within our body. And often that is what gets triggered, the original threat or the original trigger. And I think that a good therapist includes TRE or somatic therapy or things to do with the body. And although my therapist was really good, and she is really good, I felt there was just something that I needed a little bit more of. And I wasn't sure what it was. and I felt called to do magic mushrooms, and I had done it 2.5 years before. And then I decided, once I came out of that relationship, my sister had said, "Hey, we're doing this for self development. Do you want to join?" And I said, "Okay, let's do it." And I set the intention to focus on healing and focus on what I need to see and understand from that relationship and the lessons that I needed to learn and what I didn't see about myself. And I saw it from very different perspectives. You know, I did it a few times. I saw it from this angle and this angle and that angle and his point of view. And it helped me to come to a much fuller healing and being able to move on from that much quicker. And I saw that this is a very powerful tool, very powerful tool. It works with your psyche. And what is your psyche? It's your feelings, it's your emotions, it's your thoughts. And it works on a holistic level, which is what I love, because it's also mental processing, it's also emotional processing, which people often avoid or numb or don't want to go there because they're afraid they'll fall apart or that it's too painful or whatever the reason is. And it also works on a spiritual level. I have, many times asked direct questions and received direct answers. Some people don't have that experience. And I find that having a practitioner is very helpful in that instance because of the channeling that comes through for them, the quantum entanglement that comes through. And I do receive that very easily. I go into telepathy very easily. Once you've taken it really is a spiritual tool. It really does raise your vibration. I think that people can also use it to avoid all the pretty pictures and, the symbols and, if it's done recreationally rather than for self-development, which I think sometimes, yes, we need to liven up and have fun, but also it can be used as a very powerful tool. And that's the part that interests me, is that powerful tool for self-development. And that is how it's being used now in psychology. And they often use ketamine for treatment-resistant depression or convulsive therapy. That still exists. It's just more targeted now to a specific part of your brain rather than like zapping your whole brain at once. But also magic mushrooms. There's a lot of research showing that psilocybin from the mushroom, that's the active ingredient, works with your psyche to help you move out of treatment-resistant anxiety and depression in a much faster way. And that SSRIs or SNRIs, so antidepressants or anti-anxiety meds, are not really, they're not helping. They have their place, don't get me wrong. I've also taken it before myself when I needed to, when I was in that really bad space, but I knew it was for a short period of time. If a person is feeling suicidal or has suicidal ideation, as we call it, thoughts of it, they're on the verge of something like that, then yes, it definitely has its place, right? If you're on the verge of a mental breakdown, emotional breakdown, it has its place because it helps you to slow down, to make the emotions a lot more dampened so that you can deal with it in smaller chunks while you go to therapy. But it doesn't help you deal with the issue. You still have to deal with the issue. You still have to go get coached or go for therapy or whatever your modality of choice is for your healing, right? If it's Reiki, whatever it is, and my view is you need to work with yourself because only you can really heal you. You can go to a therapist and they can give you beautiful tools, and so can a coach. Therapy looks at why is this an issue? What is it triggering? Where did it start? Coaching looks at who cares where, what are we doing about it? Because you can go to therapy for 12 years, you can go for 8 years and still not move past something. So what are we doing about it? And I think a good therapist can help you through that. But coaches do focus a lot on that. What are we doing about it? And I think that both are important, both of those things, and I found both of them to be very useful when I studied both. And I had to be coached, and you have to go for therapy if you want to study psychology. You have to see what it's like to be on the other side, receiving and going through the process, so that if you decide to go that route, you also understand what it's like to be a coachee or a client, a patient, whatever you want to call it. So yeah, I think it's a very powerful tool. There's so much research on it, and also very useful for PTSD. Sometimes they would say, look, mushrooms might not be right for someone with PTSD because it could trigger very visual memories. So if you were like a soldier in war, you might not want to remember those very visual things. It might be traumatic to remember that. So there's also a therapy that they are looking at bringing out, which is MDMA therapy. So that's not natural, but it's still having benefits. It's still showing benefits for people who don't want to remember visually, but they're able to soften and feel love and feel at peace and calm when they talk about this trauma in order to work through it. So there's a lot of tools out there, there's a lot of things out there, but I'm very much of the belief that it should come from the ground and it should be natural. Because at what cost are we using unnatural things? And the download I received was it can break your DNA permanently and irreversibly. But then again, we use headache tablets, and that's, also chemicals. So it's starting to make me think, like, what are we putting in our bodies? What kind of food am I putting in my body? And the stuff that's in it, all the E's and the preservatives and the colorants, and tastes so nice and comforting, but I want to care what I put in my body, and I think it's taken me down that path of thinking about all of that.
Wow. So there's a lot of questions that I started thinking of as you were telling that story. And I'm going to start at the first one where you said you were in the difficult relationship and you went for therapy, and then you wanted to go a bit deeper, and then you started taking magic mushrooms, and then it showed you different perspectives. So what does that mean when it shows you different perspectives? How does it show you a different perspective? Is it like thoughts coming into your head, or is it giving you a visual example of a perspective? I think that's interesting for viewers to understand.
Yes, and it's a really good question because it's different for everybody how they receive. Some people receive visually. They see potentials playing out, or they see the past playing out and seeing it from another point of view, that person's point of view, or seeing both people's point of view. Sometimes just a feeling. It's just this knowingness, this download of just knowing something and realizing, making a realization. So sometimes more mental, conceptual, sometimes more feeling, sometimes more visual. So it depends on who you are as a person and how you process. But I also find that sometimes it's not that, because sometimes I process visually and sometimes just receiving an answer and sometimes just knowing and sometimes feeling. But I find that a big part of it is the feeling that people spend so much time avoiding, so much time avoiding. And if they're willing to just allow the emotions that are coming through, the anger that you didn't allow yourself to feel, the pain you didn't allow yourself to feel, the sadness that you haven't allowed yourself to feel because you're worried you're going to stay stuck there in that hole, instead of feeling it, which integrates it and therefore shifts it, so it's different, and every time you take it, it could be different. So for some people it's always visual, and for some people sometimes it's visual and sometimes not. So the question more is why, and why is this happening? And I think we need to talk about the science around it to understand that. So for I don't know if you know what a neuron looks like, but for viewers who don't, I'm going to explain it like my arm and my hand. So we have the main body of the neuron with the soma and everything, and then we have these little things coming off, which are dendrites, which look like branches of a tree, and then they have tiny little ones as well. And that's like one part of it. And then it has this long arm, just like my arm, which is the axon. And then on the other end, it has a few things called terminal buttons. And how neurons connect is that the terminal buttons of one neuron will connect with the dendrites of another neuron. And when they connect, there's a little gap, and the chemicals and the electricity and all the firing, it all goes through and is absorbed through the terminal button. Now, what happens when you take the psilocybin mushrooms is the active ingredient, the psilocybin in magic mushrooms, will make the dendrites grow longer and grow more off of them. So now there's more to connect with more terminal buttons. So you've got more dendrites and therefore connecting with more neurons, more terminal buttons. So your brain is activated more than it would normally be. And so more information is flowing through. So it can help create neuroplasticity as well, which I find is very useful for a lot of people who do what you call microdosing, where they take tiny amounts of the mushroom because they don't want to have a full on journey. They just want to, reduce their anxiety and just, um, help themselves sleep better with neurodegenerative diseases. It helps the information flow through. I know someone with Parkinson's who uses it, which he's doesn't have the shakes, but he walks very slowly. He stutters because the myelin sheaths on the neuron are not working properly to carry the information through. And now it's flooding the brain with the psilocybin and it's creating more connections so that it can flow better. And so he's less slow now. He stutters a little bit less, And just like with normal traditional psychology pills, you need to check how much each person needs, because you might need 100 milligrams for a microdose, where for someone else that I know who just finished studying his master's in psychology and he was on antidepressants, I spoke to him a lot and he got off his antidepressants and he's taking almost a gram, and that's his microdose. Where for someone that could be a full journey, could be too much, or not too much, but a macro dose for them. So it can be very useful. You need to know what you're doing though. If you're doing the microdosing, the shamanic way is 3 days you take on and 2 days you don't take. So 2 days off. So you give your body a break and then you go back on it and then 2 days off again. But the scientific way, they say the best way is 4 days on, 2 or 3 days off. You shouldn't do more than 4 days on, because then it can be too much for the body. That's when it can be poisonous. So just knowing the right amounts and what you're using it for, and I think it's a really powerful tool. And I think a lot of countries are going in that direction of, some have legalized it already for psilocybin assisted therapy, and some countries are in the process of decriminalizing it, and some have decriminalized it as well, and they're also going in that direction. So like Oregon, Colorado in America, Canada, they're already using it for psilocybin assisted therapy. Australia, and Jamaica, it's already legal, actually legal. And then also the Netherlands, it's also legal. So yeah, Brazil as well, they use it also for self-development and in a therapeutic type of way. And I'm hoping that South Africa is to follow suit soon. There's a lot of evidence and research, and there are people right now fighting it as well. There's an older lady, I'm not sure if I should mention names, but she had a court case now in May, where I need to actually check what the results was of that, in the High Court of Pretoria. And she was heavily depressed after losing her husband, and she found that the psilocybin mushrooms helped her come out of that depression more than therapy or anything else. And so she started holding for other people. And unfortunately, someone told on her, and so now she's going through that court case. There's also a shaman who's going through a court case as well, and that's happening next year. It's been ongoing, and they are both fighting it on the right to privacy, because their house was entered without a warrant, which is illegal. And they're also fighting it on the right for rituals and spiritual practice. So it's been done for thousands of years by shamans, by people in South America and North America, Cherokees, Sangomas. And I think that we need to respect it as the medicine that it is, and fight for its freedom, rather than big pharma trying to push all the medications that are just numbing everybody. And it's important to feel your emotions, because your emotions are your compass, and it tells you when something's wrong. Yes, prolonged anger can make you sick. We have so much evidence of that. But sometimes you need to feel angry to know that, wait, this isn't right. You're crossing my boundaries. I'm upset. This isn't right. This is not my value. Or, it's showing you, it's your compass. And if you're not aware of what you feel and you're numbing it so much that you don't even know what you're feeling, I think that's dangerous. And we need to deal with our stuff. And we need to deal with it through whichever modality you choose. I wouldn't bash any modality. I think they're all useful.
So I want to go into the real feeling aspect, because you say it helps you feel, or somehow helps you feel the trapped emotions. So I've had a lot of guests on this podcast show. We've spoken about this topic, about trauma, trapped trauma, somatic exercises. So I'm sure my viewers follow a bit of it. And the general topic or the general theme has been, how badly us humans deal with traumatic events. We're not taught how to deal with it. We're taught to shut it down and put it in our bodies, and we carry it around with us, right? And this is what causes energetically us to attract poor situations, or more of the same thing, because energetically we've got that bad energy trapped in us. And you go to the psychiatrist or the doctor and he gives you a pill, and that numbs your feelings, right? So you stop feeling it and it stays trapped there. But now psilocybin, and I love that you go into the science of it. So psilocybin maybe amplifies the nervous system, so the nerves can process a lot more information and deal with a lot more data. The dendrites are longer, etc. But how does it actually get you to feel, right? I mean, that's what you spoke about, and I feel that's what's important in trauma release, is to go into the actual feeling and feel it to integrate. So how does psilocybin actually help with that?
So, like I said, I think it's a very spiritual tool. I think that it connects you to your deeper self. I don't think I know because I see the result with myself as well and with others. And I think that, like I said, it works on a mental level, an emotional level, a spiritual level. I've seen people experience things across timelines, across lifetimes, even, where, let's start here. Firstly, you set intention before you take it. If you're taking it with intention, you're doing it respectfully for self-development. You're already directing it where to go, how to work with you, right? How to work with your subconscious mind, how to work with your spirit. So you're opening all of that up and you're saying, this is where I want to go. This is what I want to know. This is what I want to understand. This is what I need to let go of. This is what I'm struggling with. Please help me to release it, to understand it, to feel it, whatever. Okay. Those intentions direct where you're going to go so that it doesn't just become Alice in Wonderland. That's the difference from recreational use, right? So you're already directing it. You're already telling, but when I say it's, I also mean yourself, because it's working with you and you need to be ready. If you're not ready, you're going to fight it. I've seen people fight and then they say it's a bad trip. I don't believe that there's such a thing. There's no such thing. It takes you where you need to go. It takes you where you haven't been looking and where you keep shutting the door. It takes you to those difficult emotions you haven't been letting yourself feel, because the understanding is you will get sick if you don't deal with this. And this is where you're not moving forward in your life spiritually. So you need to go there, and people are so afraid of like feeling emotion and crying and having that snot and trana for like 15 minutes or 20 minutes and then feel, wow, I let it load off. Like, wow, I've been holding that in for so many years. Why not rather just go there, do that, and move on with your life? It takes so much more energy to try shut the door on your emotions and keep going, I don't want to go there, I don't want to go there. But we are so trained to avoid our emotions. I think what you said is such a good thing. We are so trained by society. I think it starts very young when parents don't want to deal with children crying. And so they'll say silly things like boys don't cry, and then they believe that they can't cry and they can't share, or you get teased by friends, you're a crybaby. And then you start learning, like, I'm going to get embarrassed, I'm going to get bullied, whatever it is, right? Or parents, I'm going to give you something to cry about if you don't stop crying. That's not healthy. Psychologically, it's not. And I think that also depending on the environment that you're in, with the kind of parents you grow up with, if it's an abusive environment, if it's whatever school environment was like, whatever authorities were like, right? That all impacts you. And I think if you've learned to shut yourself off and not show emotions, and sometimes even cultures, like not bashing the Asian culture at all, but just as an example, I have Asian friends and they often talk to me about how love is not often shown in their culture the way that it's shown in Western culture. It's expected to know that you're loved because your parents work really hard to take care of you and work long hours. And, they don't have that Western kind of mentality of like hugs and kisses and whatnot. You know, my friend explained to me how when she hugged her mom and she kissed her and she told her I love you, her mom felt uncomfortable because it's not done in their culture in that way. And I think that's, we have a lot of things that we're dealing with on our own, and we don't want to share because you don't talk to your parents about these things in some families or some cultures. And then it becomes really difficult, you know, if you don't want to share with your friends because you're scared you're going to get mocked, or you feel you need to deal with it on your own because you've been trained in an environment that you must rely on yourself and you can't rely on everyone else because they will disappoint you. Then you start taking everything in and just trying to shut it off because it feels overwhelming, you know. And sometimes it's repressed. Sometimes you don't even know what you don't know. I've seen people go in and they ask like, "What? Why am I like this? You know, why am I controlling?" As an example, or why do I have this intimacy issue? Whatever it is, and then a repressed memory will come up of something traumatic, and then you start to understand that when something traumatic happens and you feel hopeless in that moment, then you go to the psychology part of things where you feel the need to control things. Because if I can control the outcomes and I can prepare for all potentials, I feel calmer because I know I'm in control. Okay. False sense of control because we don't know what's going to happen. But it makes them feel more calm, right? So if it takes them to the heart of that trauma, they can understand where it came from. And sometimes that's enough to release it. Sometimes not. Sometimes you also got to do the work side by side. So I always say 50% is the journey, 50% is what are we doing afterwards? So now you know where it came from, like psychology, but what are we doing about it, the coaching? How are we moving forward so that you start changing this pattern, this maladaptive behavior that's obviously affecting your friendships or your romantic relationships or your family dynamics because you're so controlling or whatever it is. What do we do now to surrender? You know, what do we put in place now to learn to trust, to learn to let things go and let things unfold how they do, to see the other and let them have their way as well. So it's not all about you. So that's how the tool works really well side by side, you know. Sometimes with like the intimacy issues or whatever it is, you know, like I've also hear people throwing around, you know, the word narcissism a lot, and I don't think people actually know what it is. I think they love to throw it around. I've actually studied it, and I think it's important to also look at how are you a narcissist? How do you have certain qualities? Why is this person coming into your life? What are you attracting about them? What are they reflecting back to you? Maybe you don't do what they do, but you know, and as you do the shadow work around it, you also shift and move out of it. And those who do come to me who do actually have that, and they don't know they have that, but I can see it because I've studied it, I just treat them like everybody else. So you look at where is the trauma. And sometimes the repressed memories come up. They were, you know, they were neglected, they were raped, they were molested, and now they understand why they don't want to be touched. They understand why they have trust issues with people and why they don't want to, you know, get involved and be around the house with their partner. It feels overwhelming because home wasn't safe, you know. So now home still doesn't feel safe in their mind because they haven't dealt with that trauma. Things like that, right? That they felt abandoned, that's whatever it is. So we look at that and we look, is that true? Were you actually abandoned? And sometimes they were, and sometimes it's not. It's perceived abandonment, but it was enough to create the disorder, you know. And then we talk around that, and we talk around the false reality that they're creating, the false sense of ego they're creating to protect themselves. So I think it's really powerful, where in therapy it might take years to get there because you have to poke and prod and you have to wait until the person's comfortable and feels safe. And it's important. I understand why they do that. You know, a lot of people, they don't feel comfortable being challenged, straight away, or being pointed out observations straight away. They need to first feel trust and they need to feel comfortable. And that can take many sessions. It can take a week, it can take a year, it can take 3 years. And the therapist's role is, I have to go at your pace. It's when you feel safe. With coaching, it's assumed that you're here for help, so let's go there. I'm going to point out observations. I'm going to show you that, did you realize you got angry at me when I picked up the bottle of water to drink? Why was that? You know, and you help to raise their awareness, to reflect on what are they actually angry about? Because it's not about the water. What is it actually about? What came up in you? And it's like, I don't know, I felt you weren't present with me. or you're ignoring me, or I don't know, whatever it is for them, right? Or they actually don't know what they want, so everything just makes them angry, like whatever the thing is. So it helps you also just tune in. It makes it easier to see the stuff when you're in it, and it helps you to go there easier, especially for medicine practitioners and shamans who are very versed in this, and people who have done this a lot. It helps you get there quicker than having to drag it out over many years. But like I said, the other 50% is, what are you doing after your journey? Because you still need to implement the actions. You still need to make changes. You need to go and apologize to those you realized you harmed, or thank the people that you wanted to thank that you realize you haven't been grateful enough, or go create this plan or a goal setting thing for this thing and stop being afraid, and make a move, pick a lane. And if you don't like it, it's fine. We'll pick another lane, but doing nothing is what keeps you in depression, because you're so scared of making the wrong decision that you make no decision, and then you wonder why you're depressed. That's just one example of why depression could kick in, but I'm not saying it's the only reason. So it's having that, and a coach can be a really good accountability partner for that if you also do coaching sessions afterwards, which not everyone does. So yeah, you need to be an adult. You need to want your own healing. You need to want to help yourself. And I've seen people who have done amazing things when they realize what a powerful tool it is, and realize that they do need to make changes, and they action those changes. They actually do something different to get a different result. Otherwise, it's just going to be a session, and maybe you let some stuff go and you feel a bit better, but then if you don't do anything different.
Yeah. So the real essence I found out of that was, and I love that people can take the power back into their own hands for what's happening in their lives. So it's like really empowering people to be the driver of their life. So instead of the common approach might be like, if you're not feeling good, you go to the doctor, he gives you a pill, and you numb your feeling. But this way, it's really showing you what you need to deal with. So like you said, it gives you a much faster direct route to showing you your shadows. It's like really putting a light on your shadow, but you as the individual have to go and deal with it. You have to go and confront it, I guess, in your own way. It might be sitting with it, feeling it, and that's how you integrate. And I love the word integrate, because integrate is then it's not like throwing it out, but it's actually being with it, integrating, like connecting with it, and being one with it, and accepting it, I guess, in a way. And that's how it gets shifted. So as you accept it, it shifts. So my question is going to be more around the intent part, because you mentioned the intent, and it was very important, and it really made a lot of sense for me, because I know, like you said, magic mushrooms are used recreationally. People use them at festivals and parties, etc. And that's why they don't actually have that spiritual experience, because their intent is different, right? They're taking it to party. So it's quite amazing that this plant can know your intent, or sort of works with your intent. It's quite amazing that it has that ability. So it's not just a physical thing. There's something deeper in this plant, in the psilocybin, that's somehow connected with your intent. It's quite amazing. I don't know if you have any more stuff you want to share about that.
Yeah, I think intention is very important, and that's the difference between the recreational and the non-recreational, and the self-development, the therapeutic tool. When you don't set intention and you just take it, then yeah, it's just Alice in Wonderland, and just have fun and see some colors, and you know have some cool conversations. But I think that it goes, and don't get me wrong, some people have had profound experiences even without setting the intention, because they felt called to obviously take it, and it had to show them something about themselves. But usually it just becomes the Alice in Wonderland thing. when you work with it quite deeply is when you set the intentions, and that makes all the difference. And also to help yourself not get lost in your own minds and emotions, but have some direction. I always tell people you don't need to control it when you're on it. People are very afraid of losing control if they take it. And it's not about holding on to control. It's about letting go and surrendering control finally. And knowing that where you've asked to go, that's where you'll go. You don't know how you'll go there. You don't know how it's going to come up. You don't know how you're going to let it go. But you know that you've set the intention. And that's all that's needed. Because once that's done, it will naturally take you there, and trust. Because in trusting it, you're trusting yourself. And in fearing it, you're fearing yourself. Because all it really does is take you into yourself. And if we are, at least and I'm not going to say my belief, I'm going to say my knowing, because the theory is no longer a theory. I've experienced it in so many ways, and I've been shown it as well through mushrooms, is, once you deal with your big rocks and medium rocks and small rocks, eventually it also shows you deeper meanings and things to do with the nature of reality. I know that I'm God. I know that you are God. I know that everybody else is God. That rock is God, and that animal is God, the person is God. We are all divinity experiencing itself. It's not something out there. And I think that is the work. The work is always going back in. The answers are within. We know if we just do the work, but people are lazy. They don't want to do the work. They don't want to put in the time. They don't want to put in the effort. And even I fall off the bandwagon. And I'm someone who loves this stuff, and loves to do the disciplines and meditate and do, certain spiritual practices. And I also, because it's easier not to sometimes, and then you got to get back to it, And I think a lot of people don't know where to start, but a lot of what is happening in the world and a lot of what we see in others, and it's all a reflection of what's happening within, individually and collectively. It reminds me of that meme, I don't know if you've ever seen it. It's this cartoon type of man who's like under the earth, and he's sticking his hand outside of the soil, and all you see is the fingers. And it's like it looks like little people. And it's, we are one consciousness. We are that one consciousness, believing that we're having these individual experiences. But what I see in you that I think is beautiful is a reflection of what exists within me that's beautiful. What I see in you that I judge is something that I'm not willing to accept about myself that's within me. I'm not ready to go there yet, and you see that very easily with people when they're going to blame and pointing at others. And you're seeing a shadow part of yourself, because we are all one. And if we are God, we are everything. And I think a lot of people struggle to accept that God is not just love and light, it's everything. It's good, it's bad, it's color, it's gray, it's black, it's white, it's all of it. It's all the dualities. That is power, knowing that you are all of it. And knowing that gives you empowerment. It shouldn't make you feel, it should make you feel powerful, because then the next question should be, well, then who do I choose to be? If I can be all these things, who do I choose to be every day? And that is where the empowerment comes from. But you can't make that choice if you don't even know who you are. And if you are scared of who you are, definitely go and do it, because it will show you, and it's not to sit and self-flagellate, oh, I did this, and I feel so terrible. Like, yes, it might bring up guilt and shame about certain things, only to show you that you are misaligned, that this isn't going to go down a path you want, and this isn't maybe the right way for you. It's just to realign you, and that's what I believe karma actually is. It's not about things coming back at you. It's just what you're putting out, is going to have a repercussion. You have the free will choice as a God to choose what you want, but you're not free of the consequences of those choices, because that will come back to you. So it's just showing you that, and then you make the choice again. Am I realigning again? It's not, I've seen people sometimes struggle with that. You don't need to struggle. You're going in to see who you are. You're going in to see what you need to see, and then you come out and you decide, I still want to be like that. Just take the lessons, I've also seen people struggle to see their light, and always seeing the negative of themselves. And that's also difficult, always trying to remind them, like, but what about this? And look at how you did this for others, and look at how people value this in you, and they struggle to see that because of their past, because of lots of things, and reminding them to come out of that, come out of the victim mindset, empower yourself. You are both, So, yeah, that's the biggest lesson I would want everyone to take from it. And when you're ready, you'll be shown beautiful things.
Yeah, it's it's interesting that you mentioned that people want quick fixes, and that's true. People want the quick fix in society now. But if you go to a therapist, or if you're going to talk about your issues, you also mentioned it can drag on for a long time. It can take years and years, and you might not even go to that deep trauma that's been hidden in your body. Because I think what happens is you go to a therapist and they ask you, or you might talk about a topic or talk about something, and they ask you, how do you feel about that, right? I mean, that's probably a very important question. But as soon as that question comes, you have to convert that feeling into words, right? You have to convert it into words. So already you're losing a lot of information in that translation, right? The feeling is a feeling. The feeling can't be really converted into words, I don't feel, accurately, because there might not be words to describe some of the feelings. But as soon as you are forced to convert the feeling to words, you've like lost the feeling, right? And then now you're focusing on the words. Oh, this made me feel angry or frustrated or that, and you've lost that connection to the deep feel. And I feel that's why therapy can drag on, because you're not confronting the feelings. You're confronting really what the person's mental body is thinking about the situation and processing it, etc. And it sounds like these methods, the psilocybin, etc., is really not getting you to talk too much about it. I mean, the first step is to really feel it, right? To go to that feeling and feel it and be with it and sit with that feeling and feel. And then afterwards, yes, you can discuss it and talk and integrate. But I think the primary focus is really the feeling. And that's really why this method, I feel, works a lot faster. Because you mentioned it will get you there a lot faster, right? Than going to a year of therapy talks.
Look, don't get me wrong. I believe therapy is a very good thing, and I think it definitely has its place. And I think that a lot of therapists are doing a really good job. Um, I think that asking someone how they feel is important. Even in coaching, we'll do that. Because, like we said, instead of processing mentally, you need to go back to the body and where the trauma is in the body as well. So when you're asked how you're feeling, sometimes people don't even know because they're so busy mentally processing, I think, and then they get so lost in the narrative and the story, and he said and she did, and then I said, da, 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 that when saying how did that make you feel is actually raising your awareness because you're moving back and out of the story and into the body. So people might get frustrated with that question, like, oh, obviously it made me angry, or obviously it made me whatever. But a lot of people struggle to actually define what do they actually feel. You know, I can't tell you how many times clients will say, I don't know. And in coaching, there's always a rule: never say you don't know. When I ask you a question, the whole point is that you've never asked yourself this, or you haven't asked it in this way. And we also collaborating, we poking, we're prodding as well. There's a little bit of that. But the point is, I'm asking you a question to reflect on that you haven't taken the time out to actually do because you're so busy in your life with work and this and family and kids and da, 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 that you never actually take time to think, how do I actually feel about this? You know? And sometimes we even do it with spirituality, spiritual bypassing, you know? Sometimes I can do it where I'm so empathic, I can see everyone's side so clearly, even when it's happening to me, that I'm like, there's no point to be angry. You know, anger's not healthy. You're just going to create resentment and diseases. And what's the point of going there? But sometimes I need to go there because that shows me that actually something was wrong, you know, something was not okay. And sometimes I realize that after the fact, where I'm sitting in meditation and I'm like, holy, wow, I'm actually angry. And it's only coming up now that I'm sitting with myself and I'm feeling my body and I'm scanning my body and I'm seeing like, what is this weird tension? And then I realize it's anger, you know? And I'm like, well, why am I angry? Well, because I let someone overstep my boundary. You know, it's not my value, or they didn't respect me in that moment. And I made clear what is respectful to me. And then I didn't remove myself. I didn't give a consequence. So it's me I'm angry at, actually, right? Because if we zoom out and we see the spiritual lesson, it's never really about the other. But yeah, I think that mushrooms definitely helps you get to feeling a lot quicker because everything is intensified. your thoughts, your awareness of your thought process, the way you're feeling is intensified. It's all intensified. I do think it's difficult for some people to do it on their own, for a lot of people, especially those who have been numbing for years. And that's where I think it's very powerful to do it together, the coaching, therapy, and the mushrooms together. Because for a lot of people, they freak out and they're like, oh my gosh, I'm losing control, you know? And having someone there with them already makes them feel more, if they connect with you and they've heard of you and they've looked you up and they've had a bit of a chat, they see you know what you're talking about, and then they feel a lot safer with someone there with them, you know? Just having that environment of knowing there's physical and psychological safety. It's been made clear that they will not be touched at any point, that there might be just a bit of talking when they want to talk, when they're ready, can already make them feel much calmer. And then that sets up the atmosphere for a better journey, you know, and that even when it does get hard, they know there's someone there with them. There's someone witnessing their pain. There's someone witnessing their emotion and feeling it with them, and that it's okay, you know, which is also what therapy is about. Where sometimes they'll go, and they're not going to say anything, and they're just going to nod, and they're going to show you the pain on their face that they are feeling, you're feeling. And that also gives you a moment to reflect before you keep speaking. That like, oh wow, yeah, that was hard. And then you go to your feeling. You know, so I think that's a powerful tool, man.
So I wanted to get into the research. You said there's so much research going on into this wonderful plant, and the FDA is potentially going to approve it in a few years. And I suspect what's going to happen is they're going to make a pill, right? They're going to convert it into a pill or a tablet, or something that I'm going to disc him or the pharmacist, and I order this. How do you feel about it potentially becoming a pill? I guess there's good on the one side that it's going to become acceptable and regulated and um, backed by research and science. But on the other hand, it feels like this doesn't feel natural anymore. It's like you've bastardized it in a way. So how do you view that?
So, if it's not from the earth, I wouldn't want to take it. I think that it's very easy for Big Pharma to be like, okay, it's happening whether we like it or not. It's getting too big. We can't control it. So let's own it. How do we own it? Let's synthesize it. Let's pull out the active ingredient and synthesize it and scale it. And I think it's very dangerous when you take one part of a plant medicine and say, okay, this is the active ingredient, so just use this. Because there's a reason why it's in a whole plant. And I might not have the words to explain, but there's a reason why you're eating it in the way that you're eating it. It might have other elements that helps it to be safer. Like I know that with, for example, iboga, some people take ibogaine, and that can be quite dangerous. And I'm not saying don't do it, but that's why they often have doctors around with ibogaine, because there have been deaths and it can be dangerous. And that is removing the active ingredient from iboga. Where when you take the whole plant of iboga, it's not that dangerous, you know. So that means it needs to be the whole plant. There's a reason why it's that way, and yeah, they just obviously Big Pharma is just trying to own it by synthesizing it, and I wouldn't want to take it again if it's not natural. No thanks. um, and it's not to say that other things that, you know, I know someone who loves LSD, and for them they think it's out of all the things, and even plant medicines, they get the most out of it. But my question is, at what cost? Is it damaging your DNA because it's not natural, you know? And that's fine. There's no judgment if people decide to take it, but just know, know what you're putting in your body so that you're making a conscious choice.
So it's very interesting that you brought up LSD, because I wanted to bring it up because there's something about the active ingredient in LSD. I think it's called psilocin, and it's very similar in structure to psilocybin, right? I think psilocybin is a bit more complex, and psilocin is like a simplified version.
Psilocybin turns into psilocin in your body. So psilocybin itself is not psychoactive. It's only when it's turned into psilocin in your body that then it becomes psychoactive. So they both have psilocin, basically, And yeah, one is synthesized and it's, you know, made in a lab, and one is from the earth. Um, I don't want to talk too much on LSD because I can't say that I know enough about it, but I have heard from some of the research that you can get really bad flashbacks. Some people never get those things. You can go through a lot of looping. Some people don't get those things. And also, it can form crystals or something by your spine, something like that. So, you don't have any of that with mushrooms. Um, so, that's why I prefer, you know, natural. But in terms of overdosing, you can't overdose on mushrooms or LSD for that matter. There was a research study where, or at least some published information around someone who by mistake took 50 times the amount she should have taken of LSD. I can't remember what the amount was. So I don't know if it was 150 mics, 200 mics, 250 mics, I'm not sure. But whatever the normal dosage usually is, around 150 to 200, she took 50 times that amount, 50. And she landed up curing herself of a borderline personality disorder, which is interesting because psychology says you can't cure a personality disorder. It's your personality and you can't change it, which I don't agree with. I don't agree that you can't change your personality. I've seen people come and want help who are ready to make changes. Um, so yeah, you know, you might vomit, but you can't really overdose.
Yeah, I mean, they're doing the same thing. They're doing a similar thing with ayahuasca, right? Because the active ingredient, I know they've researched for decades, the dimethyltryptamine or DMT is the active ingredient in ayahuasca. And nowadays you have the DMT isolate in some sort of powder, and people consume that. And I think that misses the whole point of the plant, because the ayahuasca plant is a very sacred plant, and the process of preparing it and making the brew is also very spiritual ceremony style. And now Big Pharma has got the powder of the active ingredient, and that's what they're convincing everyone is, just as good as the plant. But I agree with you that the plant is in its capsule of that plant for a reason. The creator knew what to put in there and what complements it and what's needed for the active ingredient in your body. So I totally agree that isolating the active ingredient and making it into a tablet is not going to give you the true benefits.
It's difficult for me to comment on because, like I said, some people get benefits from using the unnatural stuff, but at what cost? At what cost is it damaging your body? And that's the issue that I have with it. I think also changa also has the DMT as well, but you've got to smoke that. But then for some people who are maybe allergic to smoke, for example, like I haven't taken it, but I'm allergic to smoke. I wouldn't be able to smoke it, you know? So then maybe pharmawaska is something that's better since we are not in the jungles of the Amazon or Peru, and maybe not everyone knows how to boil and make the stuff properly, or at least as strong as you'd like it. I don't know. So it could be another form to take it. Um, but then, are we taking it naturally? What is it mixed with? You should ask questions. What is it mixed with? Is it mixed with chemicals or not? That's where I have the, yeah. And as for the research that you spoke about, I mean, most of the research is on treatment resistant depression and anxiety. There was the Center for Psychedelic Research at Imperial College London. They published in the New England Journal of Medicine that it was as effective as antidepressants, psilocybin mushrooms, and much greater results for treating depression with much fewer side effects. There's a lot of side effects from SSRIs and SNRIs. And they also suggested replicating the study, though, on a larger scale to see does that still hold true. And then in 2016, there was a gold standard study, which they took cancer patients with life-threatening diagnosis, and the results show that more than 80% of them had significant reduction in anxiety and depression. There was also movies, which I'll get to. Well, let me get to it now. There's one called Dosed, and there's one called Dosed Trip of a Lifetime. So for the one, you might need to pay a donation, with 500 Rand, 100 Rand, whatever you can afford. The other one, I think, is free. So Dosed is about someone who was an opioid addict. and, heroin and all sorts of things. And mushrooms helped her a lot to come to self-love and just feeling oneness and not hating herself so much. But it wasn't enough for her addictions, although I have seen mushrooms be very helpful for addictions. For her, it was not enough. So she had to do iboga. Iboga is a hard reset. It resets the brain. It resets, especially for addiction. And as she came out of it, she said, I lied to you. I lied about how much I was taking and what I was on. And they said, well, if you lie to us, you have to tell us, we'll have to do it again. And she said, I understand. That's why I'm telling you. And then she did it a second time after she came clean with, what she was actually taking and what she was on. And she's been off it, all the stuff since. And she's actually a motivational speaker now. So it was quite a beautiful documentary to watch. And Dose Stripped of a Lifetime is about a lady who got diagnosed with cancer and how she took mushrooms to help her understand her life, come to peace with the fact that she might die when she didn't know if she would or wouldn't. And she actually landed up going into remission and she was fine. And then she got it a second time years later and she took mushrooms again and said she's actually fine with death now. She's okay with it. And she knows that her family will be okay. And they're talking very openly about how she feels and what she's been processing and how she doesn't want to go the chemotherapy route and all those things. She's done it. It clearly didn't work for her. She's not doing it again. And she was at peace, and just seeing how powerful it is as a tool. But anyways, getting back to some of the research as well, there was also Yale scientists that found psilocybin assists in creating the new neural connections that I spoke to you about. So they did it in mice and pigs. They couldn't do it in humans because it's too invasive. So they had to do it in animals. And they said that they realized that because it creates new neural connections and can aid neurogenesis, that's probably the reason for neuroplasticity, the neuroplasticity in the brain, and why there's such long-lasting effects on new decision-making abilities. And also positive mood changes they found, and reduction in anxiety and depression, even in the animals. So yeah, they also found, another study found that it was when it creates what I said, like with the dendrites elongating and more dendrites and all of that, not only did it create more neural connections, but 10% more. And the connections that existed and the new ones were 10% stronger than normally without taking psilocybin. So that's why you also come to feeling like, no, I know, and coming to new perspectives.
So it sounds like a lot of the research is around depression, right? How it's useful to tackle depression. And I think you said one of the studies found it to be more effective than your conventional antidepressants. So does that mean a person will have to continue taking it continuously? I mean, most people I know on antidepressants, it's like a chronic thing, and they can't get off it. And as soon as they get off, then they start getting into a panic fit, and then they have to go back on the medication again. But are you saying this is the same thing, that they're going to have to take mushrooms for the rest of their life to maintain to manage their depression?
So I wouldn't say that. I think that if it's used as a microdose only, then yes, they might need to, because you're not actually ever getting to the root and the heart of the stuff, right? There's no point swapping a chemical for a natural thing if we're still not getting to the root of the stuff, because then you're just managing. But Big Pharma wants management. They want you to manage because you're making them money. It's making tax money. It's making them billions, and that's where I have the issue with the industry, is we need to still get to the heart of the issue. So I believe very much in a macro dose first. Some shamans will tell you no, rather do the microdosing so that we see you're not allergic to it, which, I mean, rarely happens, but it could happen. So do the microdosing. Let's see how you react. If you're fine with that, then do a macro dose, which is a full journey. So let's get to the heart of the stuff. Let's uncover stuff so that we understand the basis of where we're going to continue onwards in therapy or coaching or whatever, that, the action plan afterwards. And also sometimes no action, because you just needed to feel something and release it. And then I would say microdose afterwards, because while you are making new habit formations and you are starting to learn to take time out for yourself, meditate, exercise, do all these new things that maybe you haven't done before for yourself, it can help you in those new habit formations. So then microdose, yes. Keep those neural connections open while you are creating those, because what you don't use, you lose. So you're flooding the brain with psilocybin, great, but let's keep it open while you are doing the work side by side to have those new habit formations. And then once it's easier, get off it because you've dealt with the stuff. You're dealing with the stuff. It's not supposed to be a long-term solution forever, in my view, in my opinion. And if you are, then you've just swapped one thing for another and one's a bit more natural. But the point is to empower yourself. The point is to get to the heart of stuff. But unfortunately, that doesn't make people money. So they would rather have you. I mean, I have sometimes psychologists ask me, do you think, they'll ask me stuff about the mushrooms and the psilocybin, and it will always be like the last resort that they send them to the mushrooms because they themselves don't know how to work with it yet. They haven't been trained. They haven't done training on it yet. They don't feel comfortable with it because it is a very big tool. And if they have not taken it themselves and they are too scared to take it themselves and they haven't done their self-work on it, and trust me, therapists have done self-work. You have to have been to therapy and have been through stuff in your life to even get into a master's program. But it's very different working through stuff on mushrooms versus working through stuff in therapy without mushrooms. So I very much believe, and I was interviewed for somebody's PhD who's doing it on psychedelics and specifically mushrooms, and she's a bit afraid, but she's going to start doing it because I told her you need to do your self-work on it. It's very different from your master's. Even though you're already a therapist and have been for years, you've got to go and really dig and look at what other rocks there are. Rocks, big rocks, medium rocks, small rocks, whatever, what you can do self-work on so you really understand the tool before you go and do it with another. Because you might have the theory of psychology and the theory of different therapies, but you got to understand the mushroom and not just give it to someone, right? I was given SNRIs, anti-anxiety meds, when I had a really high-pressured corporate job and I was in a toxic relationship, and it was just so much impacting. And I was working really long hours and really high pressure. And it was just too much. And I was just kind of dished these anti-anxiety meds, and within a month I got off of them. I was like, I can't function. I'm falling asleep at my desk and that's the lowest dose, and all I can think about is when am I getting home so I can sleep? And I can't, in a high-pressured environment, feel like I'm falling asleep all the time. I've got to be awake, and I realized that if I cut out sugar and I exercised from twice a week and upped it to 4 times a week, I didn't need the meds, So I think that there are people out there who understand the holistic view. I know a psychiatrist who believes in that and actually got pushed out of his last practice because he said to them, we need to stop just like boxing and pilling. We need to actually first look at holistically the lifestyle. Are they getting enough sleep? Are they drinking clean water? Are they eating good food and not too much gluten and sugar? All these things impact your gut microbiome. And I can see it in my own body. Once I cut out sugar, I'm calmer. It's just that I love the comfort food, but I've got to make the decision that it's not good for me. And I've got to choose healthier routes and eat more fruit so I get my sugars, and I can see that difference. And you need to love yourself enough to want to make those changes, and this psychiatrist has helped many people with many things that are misdiagnosed because he just got like the sleep pattern right, the routine right, the food right, and therapy, everything together, that they didn't need the meds. And sometimes they do need the meds. So like I said, things have their place, right? If there's suicidal ideation, back to that, then yes, it has its place. If you can't function and you don't have relationships that are functioning normally, and you're a nuisance at work and, your friendships are not working out and then maybe you need the meds. But also get to the heart of it first before you just go to meds. Work on it. So, and I take my hat off to people like him because usually people, they study so many years that by the time they realize they're just boxing and pilling, they're not going to change their career. They have like loans to pay from all their student debts, and this is what they were taught. They don't know any better, and they really do have your best interest at heart, but this is how they were taught at university. You treat the symptoms, but we need to get to the cause. And sometimes they do get to the cause, and sometimes they are very good at what they do, and they do draw other therapies in, and they do keep up to date with research, and they are bringing in those things, and sometimes not. And that's why I'm saying it's important that you do your research, that you feel comfortable with who you go to, that you are ready to open up as well, and that you're ready to do the work, because no therapist, no coach, no pill, no Reiki session or crystal ball or whatever healer can help you if you don't want to help yourself. And you got to be willing to do the work, because it's as within. You've got to look within, and you've got to do the work for yourself, because you love yourself, instead of relying on somebody else. Just fix me, just give me the solution, tell me what to do, give me a pill. We need to change that culture, because it's not an empowerment culture.
And I think it's clear it's not working, because we can see on the planet so many people are having mental breakdowns, mental challenges, depression is on the rise, anxiety issues are on the rise. So clearly the method of dealing with those issues are not working. They're just prolonging the issues. So I agree, there needs to be a whole paradigm shift. So just to close off, I got one last question about the psilocybins, because I noticed that there's many different types of magic mushrooms. Do they have different effects? Because I've heard, for instance, there's one called golden teachers, and apparently that's a good entry one. And then there's other ones for different types of work. So how does that work? What are the different types, and is it possible that different magic mushrooms can have different functions, within the scope of dealing with your psyche?
So I'm not going to pretend like I know about all of them, because there's 144 different strains and counting. So there are a lot of strains. um, it is believed that different strains help for different things. I have seen that, like with one strain, I think it's called Koi Tai Samui, something like that. It's more feeling. It's more like going into the feels, especially if somebody's maybe struggling with going to their feelings and is very shut off. That might be a good, way for them to start or to go towards. Golden Teacher teaches you, as we call it. So it's about the self-development. It's about seeing yourself. It's about making realizations, although you will have that with all of them, but it's a lot more about that. Sometimes the shadow work, and it's not as maybe strong. Well, depends where you get it. But sometimes it's not as strong as maybe, for example, one that's called APE. It's an abbreviation. It's a much stronger mushroom, much stronger, more psilocybin, but it's very visual, very visual. Where I received the download, that should not be used for therapy, for coaching, for anything like that, because a lot of the people who are finally ready to do the work have been avoiding for so long, or stay in their mind for so long. When we don't want to feel, we jump to the mind. That's a lot of anxiety. And I know, because even for myself, the minute you find yourself overthinking, you need to go back to your body. What am I not wanting to feel? And you notice that it feels intense, but as you keep feeling it, it gets less intense, and you start to calm. So we jump to the head to avoid the feeling. So we go to the overanalyzing. Okay. I think it's a maladaptive trauma response, actually, but we won't get into that too much. So with APE, for example, it's very visual, and I think that it can actually help people avoid more. Not to say that it will. It depends on who you are as a person. The first time I had it, that was what I was given, and it was very visual, and it was wonderful, very Alice in Wonderland, lots of things, lifetimes, and blah, blah, blah. But I noticed that I'd have to keep bringing myself back to, what did I want to deal with actually, and my intentions. And it did come up, but it's because I'm that kind of person who will go back there. Otherwise you can just get lost in the beautiful pictures and colors. So it can also be avoidance. And a lot of people that I know, that go towards a self-development, they need to stop avoiding. So we need to give them something that will be, it could still be colorful, you could still see geometric shapes, but it's not going to be all about that. It's still going to go back to you, right? And your intentions. So I think it's important that you're using At the end of the day, it's your intentions that will take you where you need to go, regardless of the strain. But yes, some strains might be better than others for certain uses. Um, NSS is, it's called Natal Super Strength, grown in Natal. That's one of South Africa as well, and that one is very strong as well. And but it depends on the person that you are, like I said. So for some people it was visual, and for some people not. You know, I experienced it as very intense, but not visual for me. Um, but I found that answers were like clearer for me, much quicker. But it's not like that for everyone. You know, I've had someone tell me, oh, they'll never do that strain again. They didn't enjoy it at all, and they struggle to get out of like looping, which I've never heard of with mushrooms. So it just, this is also why I don't like people researching it too much, because then just like you'll review anything, a coffee grinder or a straightener for your hair, you're going to see lots of good reviews and you're going to see lots of bad reviews. But at the end of the day, you need to decide, do you have the calling? Do you feel like you know, this is the way? I've heard people say, I've tried everything and I just know this is going to help. I just feel that I need to do this. And they have huge breakthroughs, huge breakthroughs. You know, I know someone who went back to their therapist and said, you were right. I did have repressed memories and it came up through these mushrooms and I felt the need to take it, and we got to it, you know. And through that, sometimes those psychologists will send people, you know, to people who do that, and hold for people to get deeper and to go to those repressed memories.
So Ofri, we really appreciate your insights. I mean, I think this is such a huge topic, and it's becoming bigger on the planet. And like you said, big pharma's jumping on the bandwagon, and we should be aware of what's happening. But the reason is it's because it's such a useful tool, and you've mentioned that a number of times throughout the podcast. It's a very powerful tool if used correctly with the right intent and with the right guidance and in the right space. It can be very, very powerful to helping you deal with issues. And I think that's what people should understand about this wonderful plant medicine. But Ofri, we really appreciate your time, and we look forward to chatting again in the future.
Yeah, looking forward to it as well. Have a beautiful day, Deepak. Thank you so much.